Welcome back to our discussion, The Role of Family Caregivers in the Healthcare System, sponsored by AARP and WTOP.com. I'm Mitchell Miller, and our guests today are John Poole, a former family caregiver and caregiver advocate, Dr. Meena Seshamani, the Director for the Center for Medicare at the Centers for Medicare and Medicaid Services, Dr. Benjamin Powers, a surgical oncologist at the University of Maryland Capital Region Health, and Nancy Lamond, the Chief Advocacy and Engagement Officer for AARP. So picking up where we were talking, what we were talking about just moments ago, there are a lot of things that are actually moving forward now in this space where, as we've talked about, it was often ignored for a long time. A lot of people doing yeoman's work without really getting any kind of assistance from state versus and even national level. I wonder if you could talk about, Nancy, a little bit about what's happening now at the national level and here in Washington.
Sure. Well, in April of this year, President Biden issued an executive order on the care economy. And what was so important about that is it really recognized the role of family caregivers for the first time and had some directives to the Department of Health and Human Services to implement support for caregivers. Dr. Seshamani's talked about some of those that they've already implemented very fast. That was April, and this is now November, and others that are on the docket. This grew out of the national strategy for family caregivers that had been developed and really was a product of bipartisan leadership on Capitol Hill, Senator Susan Collins, Senator Tammy Baldwin in 2018. Since then, we've seen a lot of activity in the executive branch, real leadership, and also beginning to see more on Capitol Hill. So right now, just last week, bipartisan legislation was introduced on the topic we discussed, which is how complicated it can be with all of these forms and all of these things you have to go through. The CMS can implement some of that itself, has the authority, but a lot of it is going to have to come from legislation. We're looking at legislation right now on health savings accounts to be sure that family caregivers could deduct some of those expenses from their health savings accounts. And also, we're strong proponents of proposals related to a caregiving tax credit for those who work and are spending a lot of out-of-pocket resources, and also a very big issue that's been discussed over the years, which is paid family leave, ability to take time off from work. As I said, 61% of family caregivers are in the workforce. Be able to take time off from your job to care for someone.
And I've noticed that this is one of the few areas in Congress, as someone who covers Congress, that there is bipartisan support for a lot of these issues because the lawmakers themselves are dealing with the very issues that we've talked about. Is that encouraging to you that you're seeing more of these proposals? And obviously legislation takes a lot more time than an executive order out of the White House, but that there is now more of these things coming into the bloodstream, if you will, of the legislative process.
Yeah, we're seeing more and more, and as you point out, it's bipartisan because it doesn't matter if you're Republican or a Democrat. If your parents are sick or someone in your family, you're going to be involved in their care. The challenge for advocacy groups like ours is to kind of build on that empathy and that understanding that exists in the political arena, which you don't always see on every issue. Build on that empathy and that concern and translate it into concrete steps that can support family caregivers and can support the federal agencies that are trying to make changes as well.
And Dr. Powers, from your standpoint, again, as somebody who's dealing with patients on a daily basis, what kind of things are you seeing that you're encouraged by that maybe things are getting a lot more attention now?
Well, I think one clear way that we're trying to move the needle is by asking. And I think it's really come out of the work of researchers who are looking into how we can screen and identify patients' needs. It is critical that we get input from these stakeholders to be able to provide them the resources and meet their needs that they have when they come to the clinic. And so I know part of my research has been to try to identify ways to screen people who are at need. We know that patients of lower socioeconomic status are less likely to get treatment, more likely to miss appointments, and more likely, particularly within the cancer space where I work, have difficulties obtaining palliative and supportive care and managing pain. That burden frequently falls on caregivers to navigate that system. So as providers, we have to ask. And one of the things that I think is really changing in the opportunities that we have, particularly one that has come out of COVID, is the use of telehealth and our ability to connect to patients to be able to do screenings via telemedicine prior to them coming to the clinic and follow up with them after they leave, to be able to assist them across sort of all of these various domains of care coordination and providing that with the assistance of their caregiver because of the role that these caregivers play in their complex cancer care. So I'm encouraged, and while this is sort of just a start, I think that there is promise to be able to really try to implement some strategies that may be useful.
And picking up on that, Dr. Seshamani, you have a very unique perspective as both a physician and a policymaker. What are some of the things that you are encouraged by, or some of the things that we should be looking for in the coming years?
I will say it is such a privilege and an honor for me to be able to bring the very personal interactions I've had with patients to the work that I do every day. You know, we've been talking about a lot of numbers. There are more than 65 million people in the Medicare program. And to piggyback off of something that John Poole said, those aren't numbers, those are people. They are individual people, each with their own story, their own needs, their own circumstances. And, you know, that is what I think is going to drive change, where we are actually having this conversation, right? 10 years ago, were we having this conversation, right? And just what you don't see, what you don't measure, you can't change. And so just the fact that we are having this very real conversation, I think is so important, and being able to bring the humanity to bear as we are tackling these complex issues, that is what is going to enable us to make that change in particularly complex and trying times.
And so you, having seen patients over the years, that's been helpful to you to see the concrete examples of what happens and what needs to be changed?
Absolutely. I mean, I bring the stories of my patients to everything I do. You know, just in this, I can tell you many stories, but, you know, just in this conversation about caregiving, I think of, there was a elderly Black woman. She was in her mid-80s who had dementia, and I diagnosed her with an aggressive salivary gland tumor. And she came in to the office with her 2 adult daughters. And the majority of that visit was actually spent with them telling me their mother's life story. Wow. About how she had moved from the South, had moved up north to give better opportunities for her family. They told me about how their mom had made them go to school, go to college, get good jobs. They're like, what you're seeing now, this is not who our mother used to be. And we're really trying to figure out what is going to be best for her now. That was easily 75% of the office visit that we had. And that was the best use of 75% of that office visit, right? And then we were able to get palliative care involved. We were able to get, oncologists involved and really figure out, how do we care for this person and for that person's family? So that's just one example of how everything that we're talking about, all the numbers that we're talking about, all the policies we're talking about, how it's actually flesh and blood and real life people.
Well, and that, of course, brings us to John Poole, who has dealt with many of these issues, and we certainly thank you again for joining us. I wonder if you could talk to us a little bit. We've discussed the many challenges that you had to deal with, but are there some areas where you, as having gone through your experience, have become a caregiver advocate? Are there areas where you are finding some encouragement? And also, what are some of the things that you would like to see as somebody who's actually gone through this?
Well, I'm very encouraged by the legislative attention that it's received in the last few years, particularly with the RAISE Act and the National Strategy for Caregivers and the President's Executive Order. Those are both 2 main things, in addition to Medicare and Medicare paying for the training of caregivers. Those are all essential key pieces of helping this issue to be, there being more solutions apply to these issues to help a greater amount of people. So I'm happy to see that's getting more attention from legislators. And also there's been more attention to it paid in the media in some instances in regard to caregivers who are portrayed on different TV shows dealing with the issues of disability or aging issues, as well as you might have a caregiver they might include caregiving as part of their backstory. So exposure on the media helps raise this issue's visibility greatly because so many people are influenced by it.
Yeah, I think it's interesting. I'm sorry, I was just going to say, I think it's interesting that as this discussion first began, there was a lot of talk about baby boomers initially dealing with some of these issues on the leading edge of this. But as you've pointed out, you were around 30 years old when this happened. And this is something, as Nancy pointed out, it spans all kinds of generations that are caught in these sandwich situations.
Yes. And I think because as you have more people who have children later in life in their late 30s, early 40s, there will be more people who experience being a caregiver earlier to some degree. That I think needs to be spoken about more.
And related to that, Nancy, I'll give you the last word here. As someone who's been involved with this personally, as you told us your story, all the way through to where we are today, what are the things that you're looking for in the future? We've touched on some of them moving ahead. Obviously, awareness is a big part of it, but it does seem like the rubber is starting to hit the road in some of these big policy issues that a lot of the people, frankly, in Washington were kind of afraid to deal with because it's such a huge issue. It's hard to get your arms around a lot of the things that we've been talking about.
Right. Well, it's a huge issue today, and it's going to be a bigger one over the next 10, 20 years. I think there are 55 million people over the age of 65 now, and that grows in 2040 to around 80 million. Think of that number. And most older Americans have some chronic condition, have something they're dealing with. And with increases in neurological diseases, Alzheimer's, ALS, Parkinson's, require a lot of care. So we are looking at even more and more demands on more and more people to be family caregivers. We'll continue our efforts, other organizations are as well, to provide the kind of information and navigation that people need at the get-go when they first become a family caregiver, and then help them through that journey. We have an exciting pilot with United Way in a number of cities for a 211 number that you can call and get local assistance, because we know you need the resources where you are, not necessarily nationally. So we're looking to expand all the resources available and to continue to work in the public policy arena. At the state level, as I've said, we've had a lot of success, need to keep pushing, and at the federal level. And I think we are moving into a place where there will be more of a policy debate broadly on home care and on long-term care. Long-term care is a huge issue for this country, and I think in the policy, we have no shortage of big challenges, but long-term care, home care is certainly on that list.
Right, those are two intertwined, and that could be a whole nother discussion, obviously. Right. But do you think that state governments, federal government, Congress, they're going to continue to need this push from organizations like yourself, yours, that have to let these people know about these problems, the issues that John talked about?
Well, and importantly, to the point everybody has made, this is affecting everyone. And doctors are hearing from their patients, we're hearing from our members, and legislators are going to hear from the people who vote for them, that this is important. It's a kitchen table issue, it's an emotional issue, it's a healthcare issue, it's an economic issue, it's all of that.
All right, well, I want to thank all of my guests. This has been a great discussion. John Poole, former family caregiver and caregiver advocate, Dr. Meena Seshamani, Director of the Center for Medicare at the Centers for Medicare and Medicaid Services, Dr. Benjamin Powers, surgical oncologist, University of Maryland, Capital Region Health, and Nancy Lamond, Chief Advocacy and Engagement Officer for AARP. I'm your moderator, Mitchell Miller. For more on this discussion, visit WTOP.com and search AARP.